Today, let's compare effectiveness of long-term maintenance beta blocker therapy after acute myocardial infarction in stable, optimally treated patients undergoing percutaneous coronary intervention. The benefits of long-term maintenance beta blocker therapy in patients with acute myocardial infarction undergoing percutaneous coronary intervention have not been well established. Methods and results using the Korean nationwide registry, a total of 7,159 patients with acute myocardial infarction treated with percutaneous coronary intervention who received beta blockers at discharge and were free from death or cardiovascular events for 3 months after percutaneous coronary intervention were included in the analysis. Patients were divided into 4 groups according to beta blocker maintenance duration: less than 12 months, 12 to less than 24 months, 24 to less than 36 months, and greater than or equal to 36 months. The primary outcome was the composite of all-cause death, recurrent myocardial infarction, heart failure, or hospitalization for unstable angina. During a mean 5 plus or minus 2.8 years of follow-up, over half of patients with acute myocardial infarction, that is 52.5%, continued beta blocker therapy beyond 3 years following percutaneous coronary intervention. After propensity score matching and propensity score marginal mean weighing through stratification, a stepwise inverse correlation was noted between beta blocker duration and risk of the primary outcomes. In a 3-year landmark analysis, beta blocker use for less than 36 months was associated with an increased risk of the primary outcomes compared with beta blocker use for greater than or equal to 36 months. To conclude, among stabilized patients with acute myocardial infarction following percutaneous coronary intervention, longer maintenance beta blocker therapy, especially for greater than 36 months, was associated with better clinical outcomes. These findings might imply that a better prognosis can be expected if patients with acute myocardial infarction maintain beta blocker therapy for greater than or equal to 36 months after percutaneous coronary intervention.